Every year, more children are born and diagnosed with autism. This diagnosis can lead to difficulties in the classroom and at home. There are studies that show that 6 out of every 1,000 children are diagnosed with autism. I will be explaining what autism is, what signs should be looked for, what kind of problems occur, and ideas on how to handle the problems. Many people do not know what autism is. It is a brain disorder that is part of a group called pervasive developmental disorders. Other disorders in this group are Rett's disorder, childhood degenerative disorder, Asperger's disorder, and pervasive developmental disorder. Of all these disorders, autism is the most common. Lorna Wing describes autism as a triad of affected abilities, which are their social skills, language skills, and behavior skills. Although every child is different, many children with autism share the same characteristics. They generally have problems with communication, paying attention in school, and having misbehavior problems. I am sure you're wondering what causes autism, but even after all the studies, they still are not sure what causes autism. Recent studies were on the immunization of children. These studies have been proven not to be connected to the cause of autism. Children who have autism are considered to be either high-functioning or low-functioning. If a child is considered to be high-functioning, they generally have problems with their social skills. If they are considered to be low-functioning, they struggle with both language and social skills. Some children who are considered to be high-functioning may have a case of hyperlexia. Hyperlexia is known as a strong early reading ability accompanied by difficulty acquiring language or social skills. Some children have sensory problems. This is where certain stimuli make them uncomfortable, unable to focus, and may also make them anxious. Social skill problems that are very common with autism. They may not respond to their name, or they may have trouble making eye contact with who is communicating with them. When the child has language difficulties, they generally do not understand what is being said, and they appear to not be paying attention. Behavior problems usually occur because of issues with their social and language skills. A common characteristic of behavior problems is joint attention. Other problems include things like not understanding the difference between teasing and teasing, or not understanding what is being said. If they don't understand what is being said, then they appear to not be paying attention. In order for a teacher to understand a child with autism, they must first understand what autism is. Then they need to refer to the parents to understand that particular child. By understanding the child, the teacher can identify the problem and come up with solutions to make the child more comfortable in the environment. There are 2 plans that have been proven to be very effective. These plans are called Individualized Education Plan and Discrete Trial Teaching. These are designed to promote better academics for the child. Although many problems with autism are focused towards the school, the same needs are present at home. It has been stated that overly protecting the child does not allow them to develop properly. Home environment should have cohesion to keep the anxiousness of the child to a minimum. Although having a child with autism is difficult, understanding the social, language, and behavior problems that are common will make it less surprising. When problems are understood, solutions are able to be made, which is essential to a child with autism. Are there any questions?
Yes. What is joint attention?
Joint attention is where the child has problems keeping a mutual gazing, like when somebody is looking towards something, they aren't able to notice that what they're looking at and look at the same thing. Any other questions?
What is individualized education program?
The individualized education program is where the child is presented with a mentor. The mentor works with the child and creates long-term and short-term goals. These goals are to help promote the child's academics and allows the child to be more comfortable in school. The child works with this mentor from the time they're in school until the time they're the age of 21, or until the parent changes their mind on the program. Anything else?
What is discrete trial teaching?
Discrete trial teaching is when a teacher presents the child with a stimulus. The child is promoted to advance the stimulus, and once the child does this, they're presented with a positive consequence. By presenting the child with a positive consequence, it allows the child to become familiar with the task at hand and allows them to continue doing these things. Anything else?
No, thank you.
Thank you.